And I have really been looking forward to this discussion for quite some time. I'd love to welcome Tara Ballman, the Executive Director of the National Aging in Place Council, to the stage. But today we're going to be learning about the National Aging in Place Council, but more importantly, we're going to dive into this new book that they just published, Aging in Place Conversations. So, Tara, great seeing you. We're on both sides of the country right now. Tara's in Orange County, California, and I'm in Washington, D.C. But really excited to dive into the discussion today and learn about the Aging in Place Council in the book. But before we do that, let's get to know you a little bit better. Tell us a little bit about your background and what led to your current position.
Sure. Well, hi. Thank you. Hi, everyone. Thanks for having me on this morning. I'm always thrilled to come and talk about NAIPC and aging in place and anything that helps make aging easier. So my background is actually the opposite of everything I'm doing now, I feel like. But I was in music and music business, and then working in Texas, and I got that dreaded call that no kid ever wants to receive, that my father had cancer. So it really changed the whole course of my life and how all my actions. So I ended up moving. I was in Texas. My family was in Florida. I ended up moving back to Florida, and my father had just retired and got into his second career in retirement, which was reverse mortgages. So this was back in 2000, from 2000 to 2004, I guess. And he's like, hey, why don't you come check out this reverse mortgage world with me? And so I did. I started off, as a processor, and went into sales and the whole 9 yards with my dad and his company. And I ended up writing my first book then, which was, just happened to have a copy here, the Reverse Mortgage Handbook. This was published back in 2004 or 5. And then I wrote another one, Reverse Credibility, which this one was more for consumers. The reverse credibility is more for the industry and just kind of how to deal with seniors, everything from process, intent, and expertise. So that was really how I got into the senior world. And then one way or the other, I just ended up meeting my husband. He does outpatient physical therapy in patients' homes here in Orange County. So I got back into the senior world that way, and we joined the Orange County chapter of the National Aging in Place Council, which is how I got involved with this group. And I just love it so much. I kept volunteering and saying yes to things, and served on the board. And now I'm the executive director of the organization as of last August. So I'm very excited about that. I love this group. I love our people. I love the help that we send out in the community. So yeah, thanks for having me on to talk about all of that today.
I love it. I love it. And so many of the professionals in this field, our path has a personal story to it, which is what makes this profession so great. So, out of curiosity, what was your involvement in the music industry?
Well, I was more in the marketing and PR side of
Oh,
things. So
okay.
in Texas, I worked at Fort Hood and MWR and put on concerts for.
Okay, all right. No, no. You were saying that it was the opposite of this segment, and as we know, music therapy is alive and well in and some just amazing music programs um,
Yes.
are a part of this. So something that we're all real passionate about. Okay, well, so let's talk about. Well, first off, let's talk about what the National Aging in Place Council is. I remember when I've been around for 32 years in this field, and I remember when the association was first started. But what's goals, mission, and I've got let's see here the you you guys have a website here which I can pull up, but tell us a little bit about the organization.
Sure. So the National Aging in Place Council has been around for 15 years. We are a nonprofit trade organization. We are also a nonprofit foundation. We do have a foundation that we're making more active right now, but our mission is really to connect professionals and communities to bring them together to champion aging in place issues through collaboration, education, and advocacy. So All of our members fall within what we consider the 5 pillars of aging, which is housing, healthcare, finance, transportation, and social interaction. So we have everything from gerontologists to mobile dentists and dog walkers, home declutters, anything that is making aging easier in whatever spot you choose to age. I know a lot of people hear aging in place and they automatically think the home that I've raised all my kids in and I've been here forever, but that is not necessarily the case. It's really about taking control of your decisions and your choice on where you want to live and how you want to live that life, and then creating a plan around it to make sure you can live in that place in that manner for as long as possible. So for some people, aging in place is in a memory care center, and for some people it is in the home they've raised their kids in for, you know, the last however many years.
Great. No, I love it. And with that, it's a great segue for this book that you've written. And what I love about this book is that there's not one sole author. I believe there's 20 authors. And tell us a little bit about this book, and I can pull up the table of contents here.
Oh, that would be great.
While you're talking about that.
I also happen to have a copy of that too, hot off the press on Amazon. It was just released on Monday, I think, officially to everyone. So this is really 20 of our members from across the country. We have all different backgrounds. The person behind this, the mastermind behind this, I'm not sure if she made it on the call this morning, was Gina Knight, who is chair of our Chicagoland chapter. But we really took the top questions that were asked and we put them into a book form. And at the beginning, we really, as you can see there from the table of contents, we explain a little bit about what aging in place means. And Scott Fulton, who's our chair of the board, wrote that first section. And he has a whole section on the best before date. You know, if you can do things before things expire, your options are vast. Whereas if you wait until a crisis, you know, as we all know, they slim. So where you talk about that a little bit, and then the 5 pillars of aging. In those pillars, we really take those questions, and it's a question and answer format. And then in some sections, like the Medicare, we just have one person answering it. But in other sections, we have sometimes 2, 3, or 4 authors answering the same question, because everyone approaches things a little bit differently and has a little bit different flavor to add depending on what section of the country they're in as well. So the thing I'm also most excited about at the end, the notes and resource section, we've kind of grabbed everything and put it into one spot, all of these national resources. We have plans for future additions with local resources, but there's QR codes so people can just scan it and it takes you right to the elder care locator website. So we're making it as easy as possible for people to get the information.
Great. Yeah, I'm really impressed with the organization of this. I love the 5 pillars of aging. I mean, we generally talk about all 5 on every single one of these discussions that we have. So they intersect very nicely, and really looks very well thought out, and I love it. And I also love to see my good friend Louis Tenenbaum is the person that wrote the foreword for you. Definitely a pioneer in the segment of, or on the topic of aging in place. So let's see, a couple of things. I think there's a few of your authors that are in the audience. And maybe the best way to do this is, if you're one of the authors of the book and you're in the audience and you wouldn't mind coming on stage and maybe talking a little bit about your chapter, raise your virtual hand. So I got Vicki Gold, and I got Amy Miller, and I got Dina and Ronnie. And so if you all come to the stage, you should be prompted. And wait.
There's Courtney too. Courtney,
wait, hold on a second. Here, I'm gonna make them all panelists. Let's do it this way. This is gonna make it a lot easier. Okay,
And
See?
also, all of the people that are on today, next week is Aging in Place Week, October 10th through 14th. And everyone that's on the call today is also speaking during our Aging in Place Week. So if you're interested in their topics, send me a note and I'll invite you to their sessions. There's Vicki.
Okay. All right. It's getting kind of crowded here.
Yeah.
I got to put my mask on. Yeah. Okay, and let's see, Richard, and I think I got everybody who raised their hand. So if you're one of the authors of this book and you're in the audience, raise your hand and click that button that says promote to panelists. So let's just do the little Brady Bunch thing here, so first, Tara, since while we're waiting for Richard to jump on stage, tell us a little bit about the section that you were involved in the book, and maybe give us some words of wisdom on things that our community can be thinking about.
Well, it's interesting, when we got together to write this book, I wrote the section on transportation, and it was kind of by default because that's an area where there's a serious need. And I think that was highlighted by this book, is that we need more transportation for our seniors out there. I think I put a quote in there. 76% of baby boomers see driving as their key to independence, but they just assume they're always going to be able to drive. And then when they can't, or you have to have that difficult discussion that you've never had before of taking the keys away, then it gets really awkward. So I think the most important thing about this book, in my section and everybody's section, is really the importance of planning ahead, and how many more resources are available if you plan ahead, and how easier the discussions are if you start talking about it now instead of when there's an accident. So yeah, I'm excited about the stuff that I learned while I was writing the book. There's actually a group, I haven't marked in my book here because I kind of love it. It's like the Community Transportation Association, where here in Orange County, I could volunteer my time and take older adults around doctor's appointments, shopping, whatever, and I'm earning credits. And somebody in Atlanta, where my mom lives, I can use those credits, and somebody will drive my mom around there and take her to doctor's appointments. And that person's earning credits for their mom in Minnesota. So that's one of the organizations I learned about out there.
And I'm glad you brought that up, because that's the concept of time banking, which is something that we haven't discussed. And I need to make a note to do a discussion on time banking, because it is absolutely amazing. I jumped the gun and somebody sort of brought it to my attention. Where and how can we order the book? Is it off of your website?
Oh, it's actually on Amazon, amazon.com.
Okay. So if one of the authors can drop that into chat, that would be great. And that would be amazing. And Linda, and again, the title of the book again?
It is Aging in Place Conversations, What Industry Experts Have to Say.
Okay, so Linda, that hopefully answers your question there. Let's see. Let's next on. So what I'm going to say to our audience members: transportation, one great talking point as it relates to aging in place. Feel free to ask questions, comments. If you have solutions, like one of the things whenever we talk about transportation, I always like to throw out there go grandparents. It's some technology that enables us to use Uber and Lyft without having a smartphone. And so let's make this a sharing experience as we talk about this book and these solutions. So Vicki, let me pull our table of contents up again. What chapter of the book were you involved with?
I'm with the wellness, the second pillar, health and wellness.
Great. And what is your area of expertise? Tell us a little bit about yourself.
So I'm a retired physical therapist. I was in the field more than 50 years. I turned 78 in September. I'm like really excited about that. Over the years, I had a lot of experience with certain mind-body techniques, yoga, Pilates, Tai Chi, Alexander and Feldenkrais techniques. So I created an ABC system, which I discuss in the book. So it's a mind-body approach to physical and mental well-being, alignment, breathing, centering. So that's my focus, and also have a little segment on fall prevention and dealing with fear of falling. I think the other authors did a more detailed discussions about things to do to prevent falls. I dealt with that fear of falling and figuring out, correct shoes and things like that.
Well, I'm glad you brought up mind body. I think that thanks to the pandemic, more than ever now, we are aware of mental health issues, the techniques and abilities, and the value of exercise and other activities to keep our mind and body active. But one of the things, and I don't know if it's in the health or wellness in your chapter or if one of our other panel members is, one of the challenges of aging in place is loneliness and isolation that we've all experienced firsthand thanks to the pandemic. And obviously that ties into transportation. If you can't get around, you're sitting at home all alone.
Right.
Did you all dive into that in I guess the health and wellness chapter?
I just wanted to add one thing and then I'll, back off. But one of the very important focuses of mind body wellness, especially for stress reduction, I focus on the slow, prolonged exhalations, the conscious breathing with the focus on exhalations. So I just wanted to get that in.
I love it. I love it. All right. Well, thanks so much, Vicki, and congrats on being a part of this interesting book. And so next on my little screen, I've got Amy Miller. And then just in case your screen looks different, I'll go to Deanne after Amy. So Amy, tell us a little bit about yourself and what chapter were you involved in?
So I am the founder of Our Family Encounter, and I'm out of Minneapolis, Minnesota. And one of the things I'm looking forward to is actually talking with the adult children, because I'm of the mindset that the family needs to become more engaged and what needs to happen. And then also what I call is the forgotten middle, which might be a term people are familiar with or maybe not.
No, tell us what it is, just in case.
So a lot of times the amount of care or the amount of services you get are based on how much income you have. So either you're at the very low end, which I call there's the ones that tend to get the public support, which I count, not to put numbers on it, but I'm going to, because it is about numbers, is about 20% of the senior population. And then on the other end of the population is about 30%, and those who have saved or have the funds to provide whatever services they need and get the advice they need. The numbers in the middle are what I call the forgotten middle, which is they have too much money, but not enough. And I count that for about half of seniors. So how do we come around and help them age in place or make the decisions that they need to make so they can be successful?
I'm really glad you brought that up. I like the term forgotten middle, and that's what I thought it was. I've always referred to it as the caught between the cracks group. It's the group of folks that have done all the right things, saved, put their kids through school, raised families, did all this stuff. But when you start doing the math, the numbers don't quite add up. And that group needs to be very resourceful. And I actually like aging in place is a solution. Now, and one of the aging in place solutions is home sharing, which is a big trend that can help save money. It can reduce the loneliness and isolation, and you just got to be resourceful with that forgotten middle there.
And I'd also like to add, multi-generational homes is also very popular. Something that maybe people don't realize they can do is they can pay their family members directly for their care with what I call a family caregiving agreement. So it's an agreement you make ahead of time, and you decide how much you want to pay for daily services. So it's something that's available in all 50 states. How much you can pay or how much insurance might pay. Let's say you have a long-term care policy. It's possible they could pay the family members instead of being direct pay, but both are options.
Yeah, and as I know it's going to be a common theme because we've already talked about it with all of us, is that planning ahead is essential to take full advantage of those. And the thing that I'm going to say is that everybody who's on the stage and everybody who's in the audience, you guys are already doing this. Just attending a discussion like this, you're planning ahead. What we need is you to spread the word about all these great resources. And the book is a great thing that you can drop on the table to one of those scramblers. I like to refer to them as they only plan when there's a crisis. And so what a great gift, especially as we move into the holiday seasons, that could get people thinking about this in advance. Let's see. I know we've got a couple of questions. I'm just glancing at chat briefly there. This is being recorded and all of the chat comments are going to be recorded as well. So that'll be up on the site later today. Okay, thanks a lot, Amy. And let me move to Deanne. And I'm sure I mispronounced your first name, didn't I?
Actually, no, that was perfect.
Wow, I can't believe it.
Look at that.
So, okay, Deanne, tell us a little bit about yourself and what part of the book did you play a role in?
So for me, I am a senior advocate. So I have my hands in all areas. And that is because I am the chairperson for the City of Las Vegas Senior Citizens Board. I brought a senior services department 5 years ago to our city because our demographics are very large population. This is a retirement city. And obviously I'm also on the board with the NAIPC. And so this authorship has just been yet another extension of being able to reach the older adult population here. And I am also what you call a mindset development specialist. I've been doing that for about 30 years. And what's interesting is in my discussions with seniors, everything that I do, my advocacy, mindset is in everything. It's in every single pillar of this book. Understanding where our older adults are coming from, their past, their habits, what was in their life, helps us to better have conversations with them. And those are some of my pillars, is into the health and wellness, talking about these communications. How do you communicate with them moving forward if they need to go someplace now where they need assistance or have assistance coming in the home? We have to relate to them. Otherwise, we're coming at them with this information and they're going into denial phase. Well, there's a reason for that. And, I also have a fall prevention part in this, and that's denial all the time. Thoughts are behind that, because if you're distracted with the millions of thoughts that are coming in every minute, and this is scientific, it's obviously going to cause a fall because you're not looking at that area rug. Mm-hmm. You're not looking at the curio cabinet that has all your beautiful trinkets in it, and you don't realize you're kind of being careful while you walk by it. There's just so many things behind it. So that's why I'm doing next week the Zoom for, understanding the mindset of our seniors. When you're going to them with home care, whatever you're going to them with, you have to understand their mindset. And us, we need to know our mindset while we're working with them. So it's full circle. So those are my sections of the book.
I love it. And I love the mindset and communication piece to this. In fact, actually yesterday I was talking to somebody about the resistance to sort of suggestions. And what I suggested, because I catch myself all the time, I said, hey, this is not untoward or it shouldn't be deceptive, but record yourself talking to your mom and play that back after you have that conversation and ask yourself, would you like to be communicated with that way? Because, and actually she didn't even need to do it. She replayed the conversation. She goes, I am not communicating with my mom in a very authentic or appropriate way. And I really like I really like mindset. That we need to understand the people that we're trying to help, their mindset to appropriately communicate and make suggestions. I love it. Great. Okay. Next on my list is Ronnie. Ronnie, tell us, and then I'll go to Courtney and Richard. Tell me a little bit about your background and your contribution to this interesting book.
First, I usually start off by saying I'm a widow of now 11 years as of this week, actually. My husband was, well, let me say it this way. We met in our 40s, we married in our early 50s, and he died at the age of 61. So it's sort of a different kind of path. Out of that path, it came my business. I've been in international sales and marketing consulting for 20 years as a sole practitioner, and loved it. But after that, sort of settling all the affairs, through the encouragement of some friends, I started the business I have today called Bereavement Navigators, where I work with widows, widowers, and adult children on all the personal and practical tasks after the death of a loved one. So I don't do bereavement counseling. A task could be referring out to a bereavement or grief support group. I also have a second part of my business where I help, I help what I call healthy baby boomers create their own what I call personal succession plan, similar to a lifeboat drill, to ensure a smooth transition when one's affairs need to be managed by a loved one. So if you think of being on a cruise ship, let's say, and at 4 o'clock in the afternoon, you come out and you get all the information of what happens if you have to enter the lifeboats, but you don't go in. That's kind of what I do in terms of planning for the future. Nobody dies yet, but we're planning. Okay. So those two service offerings, the first one I call after a death consulting, and the second one I call, in parentheses, long before a death consulting.
I love it. And I will tell you that the number one topic on our platform is solo aging. And it's a term that people use very proudly. I'm a solo ager and I'm trying to figure this out. But what I also love about solo aging is, like you, and this is hard for a lot of people to stomach, but all good marriages end in death. Okay.
Yeah.
Like if you're happily married, you know, that marriage is going to end with either both of you dying at the same time, which we know is not going to happen unless you're in some catastrophic plane accident, or one spouse is going to outlive the other, like in the case of you, which turns you into a solo ager, and now you're, you know, making plans. And I think what I love about this topic of solo aging is that it starts getting people thinking and planning in advance, because they know the odds are one or the other is going to outlive. And it's a better way to sort of frame planning than saying, hey, you got to start thinking about assisted living or grab bars in the bathroom.
Right.
It's sort of like, you got to start thinking about your solo aging plan. So what wonderful, all of you, I'm just intrigued by the unique directions that you all have come together and approached this from all of your different business ventures. So Ronnie, this is great. Okay, so next on the list is Courtney, who I've met Courtney at an online meeting. So great to see you, Courtney. And I think I knew you were involved in this book, but when I saw you pop up there, I was like, I know you. But tell us a little bit about your background and what section you're involved in here.
Yeah, it's good to see you too, Steve, and hello, everybody. So I am the founder of Generational Support, LLC, which is a blog as well as a caregiving consultant company. And my background is I started off in a CCRC, which stands for Community Care, Continuing Care Community, Retirement Community. I'll say it properly. And I started off in the nursing care floor as activities director. So I was doing daily activities, care plans, working with nurses, CNAs, adult children, power of attorneys, ombudsmen, everything. So I have that whole background. And then I got promoted a few years later to director of marketing for the assisted living and nursing care, which then was sales and intake and all of that. So I worked with hospital discharge and social workers and lawyers, financial advisors, the gamut. So I really have a full understanding of everything, as well as having had a father with cancer that died at the young age of 65. So I am one of 4 children, and I, having been working, and he actually lived in the nursing care floor where I worked. So I was able to help my mom and my siblings with that. So I really have a full understanding of all of the aging industry, which is why I created generational support. And that leads to being one of the privileged 20 to be part of the book. And I am mostly in the housing and health and wellness chapters. I talk about moving into a community, some questions people ask about pets and adult children. I explain some of those things, understanding all the paperwork that goes into it, having done marketing. And then in the health and wellness, I talk about different needs when meeting with primary care physicians, as well as elder law attorneys. So I have a grand understanding of all of that, which is why I talk about it in the book. So, and then lastly, next week, I'm also speaking on the National Aging in Place Week podcast on Friday. And my topic will be on hospital discharge planning and what you need to know when you're helping somebody that is currently in the hospital and getting ready to leave. So.
That's great. And I think we've got you scheduled at some point on our calendar to talk about that topic, because it's, again, a real hot discussion topic. A few of you have been referencing next week and this discussions. Where can I find that on the website, Tara?
So if you click down under events, over to the right.
Oh, right here?
Drop down right
Yep,
there, and that will bring up the whole calendar. So okay. Amy talked about the forgotten middle. She's speaking about that in detail on Monday. But yeah, we have all sorts of events. We even have a older adult author who's coming on and doing a book reading about a group of seniors who witnessed a murder and went into the witness protection program and ended up in a retirement center. So we've got a little bit of something for everyone there.
Wow, that is very intriguing there. Where's that on?
Friday at 11, the book reading. It's called, I was about to do a little promo on LinkedIn.
Is it a novel, or is it it's a novel? Okay, I was like, holy cow, man. if that's nonfiction, I am planning on tuning in. Okay. No, I'll plan on tuning in anyways, but yeah, no, that's okay. Well, the last person I've got on my little Brady Bunch screen here is Richard, and I don't even know if he knows his camera is on. So if he Richard?
He's not actually an author of our book, but it's nice to see Richard.
Hey, Richard.
Yeah, I was. I don't know why I got the banner up on my screen that said you're invited to be a panelist, because.
Oh, I apologize. You raised your hand, and there's so many authors. I just assumed you were.
Raised their hands. I've spent 35 years in the military. Somebody says do something, I generally do it.
Okay. Okay, great. Okay. Okay, so I'm glad we got through all of the authors that are here, and hold on. And now I want to remind our audience that they can jump in with any questions for this amazing panel and topics of discussion. But I want to kind of jump to what I saw on the table of contents is chapter 1 here, which is, what does aging in place mean? Because the term now gets thrown around an awful lot, and I think there's not one set definition, but the National Aging in Place Council if there's any governing body that can define aging in place, I would say it's you all. Is that something that you all are working on, or is it best to just keep it this loosely defined term for anyone and everyone?
Well, that's interesting. I think people's perspective on aging in place has changed over the last few years. So where before I feel like it kind of had a different meaning behind it, now we've all been aging in place, living in place, surviving in place, working in place. So it's a lot easier for people to wrap their minds around that concept of aging in place you want, the manner you choose, in the community you want, with the transportation options around you that you desire. So that's the way I explain it. I don't know if anybody else, I'm curious to hear Amy's definition of aging in place.
Folks jump in.
I think in some cases it's what can you afford? It also is, and especially now, I think there's a changing trend, as you were mentioning, Steve, about new alternatives of what is aging in place. Is it with a roommate? Is it with family? Is it something that's even a possibility is international? People don't think about retiring in another community outside of the United States. So it could be, whoever you, as you mentioned, Tara, whoever you consider to be your community, but it's how you decide you want to age.
I'll jump in if was somebody else going to speak?
Oh, jump in. No, this is a roundtable discussion now. Yeah.
Okay. I'll do it after you, Vicki.
So of course, my focus is that, you have all these other things in place, but are you physically and attitudinally in good enough shape to maintain your independence? So you can have, and that's where the book is so fabulous, because you've got all these different approaches. I just want to make sure that your body is up to doing what it needs to do so you can stay in your home.
Okay, we're getting a bunch of good questions coming in. One, I want to catch you on there, Tara. This is great. Tara, what is that credit program that you referenced earlier?
Oh, let me pull it up in my transportation section. It is called, because I don't know the name of it off the top of my head, the Community Transportation Association of America, CTAA.org.
Okay, great. All right, I'm dropping that website into chat there for folks, and I'm really excited to take a peek at that one myself. And then before today's discussion, we all know that AARP does this study on people's preferences on where to live. And I quote it all the time. And I was like, I quote this darn thing so much. I got to see if they've updated it. They just updated it with COVID. And I wanted to share this with folks on this definition of aging in place. And I'm going to share the whole research with everybody. But, more than 6 to 10 adults would like to remain in their community or current resident as long as possible. Me personally, when I'm talking about aging in place, is I always tell folks, aging in place, maybe think about that as staying put in the home that you're at right now, whether that be your single family home you lived in for 40 years or an apartment or even an assisted living. And then aging in community is staying in the general vicinity of where you are, so you can go to the same dry cleaners now that you were currently going to. But and I was really pleased to see that AARP asked that of their study participants, is I really want to remain in my community, or I really want to remain in my current residence. And lots of good stuff. As we know, AARP has a ton of money to do some great studies. So I'm dropping that in in there. But let me dive into some of the questions that I see pouring in here. First off is, how much advocacy is the National Association of Aging in Place doing, state and federal?
Yes, well, that is a very good and timely question, as a matter of fact. We have had an advocacy committee that has been a little bit inactive up until now. And one of the reasons that we asked Lewis to write the foreword of this book is really to help push through the legislation, the HR 7676 that was, I think it died in this last session, but we're going to get involved there. Actually, Lewis and his team is speaking on October 20th at our meeting about this plan to allow people under the age of 59 and a half to withdraw tax-free, penalty-free funds from your retirement plan to make aging in place modifications to the home. And if you're over 70, it counts towards whatever the minimum distribution requirements are. So that's something that, regardless of your political views, I think we can all get behind to support seniors and aging, and it's a way we can come together. So we're looking for projects like that we can get behind. So Lewis is our first step back into advocacy.
Well, that's a great first step, and it sort of follows up on Barbara's question. In addition to get money for home and community-based services, but I love that, and I love that initiative. And the way I frame that is that think about, like, none of us were thinking about solar panels for our house or eco-friendly hot water heaters. It's because there was an incentive, and if we can create those incentives for aging in place improvements, that would be amazing. Because this panel right here is so interesting, we're getting a lot of questions. I see Tom is asking about the mindset and what have you. I would say to the panel members, if you can drop in your contact info into chat, that would be great. And then Tara, you can probably give me a spreadsheet or something with the contact info for all the authors of the book. Maybe we'll post that underneath our the recording as well, so that people can follow up with some of the individual authors. Let's see. A couple of other things here. A lot of folks, and Barbara Sullivan is the executive director for the National Village to Village movement, which is a great advocate for aging in place and aging in community. And I actually think there was somebody here who said, the Village to Village movement 20 years ago pioneered aging in place. I've been in this business for 32 years, and Louis Tenenbaum was using the term aging in place way back then, but I credit the Village movement for bringing the term aging in place to be to the forefront. It was the grassroots effort of the villages has been absolutely incredible to basically say, hey, look, we're neighbors, we're coming together to stay put in the neighborhood that we love. And so I can't thank the Village movement enough for that. So thank you for sharing that there. And okay, Faith asks, it seems there is an inherent conflict between aging in one's community as long as possible versus life plan communities or CCRCs wanting you to move before you need personal care. If somebody could, or several of you could comment on that.
I'm going to see if Courtney's comfortable. Or
I can take that, yes. It's a great question, and it really depends on the individual as well as your financial means. A CCRC is more for the upper middle to upper income people that can afford large entrance fees, which usually start around $400,000 for an independent living apartment. But the way that it's promoted is that you are basically buying kind of a health insurance policy, meaning that when you when you reserve the apartment and you pay this entrance fee, if ever you need nursing or assisted living in the future, your monthly fee to move to those other types of apartments will be significantly less than if somebody moved directly into the assisted living or nursing care. So it's actually a win-win by going into independent living in the beginning. And the hope is that while you're in independent living, you are getting the socialization, the community, all the perks of housekeeping and food and beverage, so that you maintain your quality of life and hopefully never need assisted living nursing care. Now we can't, see the future and know if you have a bad fall or need emergency surgery or something like that. Those things happen. But if you're fortunate to live in independent living your entire life, a lot of the communities also, there's usually like a 50 to a 90% refund of your entrance fee given back to your estate too.
Great. No, great response to that. And I will tell you that on a regular basis, I'm talking to folks that say, I'm not ready yet to move to Shady Acres Life Plan community. And then something happens and then they want to move. And it's sort of like, hey, we're sorry, with some of the policies in the Life Plan communities, like you said, Faith, some of these communities, their intention is get folks while they're active and be able to take care of them for a lifetime. So hopefully that gave you some good food for thought there. Melissa says, Melissa's actually from Handy Pro, which does universal design remodeling. She says, does the National Aging in Place Council have a podcast? And I believe we looked at that. And does the organization have a service directory? So let me ask you, can providers and consumers join the National Aging in Place Council?
So right now our membership is related to seniors that are professionals dealing with older adults. So only those working right now. We have talked about creating a separate kind of membership level for older adults, but we're not quite there yet. But we do have a podcast. It's also called Aging in Place Conversations. If you scroll all the way down to the bottom of that home screen, you can see links to past podcasts. There it is, Conversations with Tara and Ryan, and our LinkedIn pages there. But we do have a service directory all the way at the top. If you look for service providers, that takes you to a search screen. So that can link you by category, by chapter. We have a lot of our members aren't part of chapters. They're just floating across the country. So
yeah. So now, so how do we join if you're interested in joining?
Well, right there in the Become a Member tab, or back on our other website, there's a big button at the top right that says Become a Member.
Okay, got it. This is great. So Melissa, hopefully that helps, and I think this could be a very relevant group for a company like Handy Pro to join. And let's see, you talked about chapters, so it looks like there are quite a few here across the country, and that's great for connecting those aging in place providers that are local, because as we know, when it comes to aging in place, one of the, I always get nervous when I talk about the benefits of senior living communities on an aging in place topic. But one of the benefits of moving to a community is you move in and all these supportive services are right there because you made that decision. All of those support services can be provided in our homes, but it takes a little bit of coordination. So I like the approach that you have with the local chapters, because it enables the providers to connect with each other to provide that holistic support to the individual that wants to age in place.
Steve, if I can jump in, I just want to make sure Tara has time to say that one of the things that she'd probably like us to do, especially I'm in a small town that doesn't have any aging in place chapter, but that people could be informed about starting one.
Yes, thank you, Vicki. That was perfect. We actually have between 5 and 7, I think, chapters right now in different stages of formation, in small towns and in large towns. We're across the board. I think our largest chapter right now is Long Island. in New York, but Chicagoland and Atlanta are close behind. But it's even just regionally, like here, I'm in Orange County, we have a San Diego chapter. The needs of people just 1 hour down the road from me are so different. So those local chapters really help us get the seniors on the ground, and then the national helps support you supporting your work nationally and with seniors. I see Ken ask, is there a Metro DC chapter? Yes, there is. It is, I think we call it Metro DC. Is that Northern Virginia? Does that count as Metro DC?
Yeah.
It's close.
Yeah, but I could see we're Mid-Atlantic, largely a Mid-Atlantic community. And so hopefully we could help you cover Baltimore, Maryland, and I see you got Pittsburgh, but we've also got Philadelphia there. So hopefully that it sounds like there's a lot going on. And the main thing is that if you got an idea, reach out to Tara and maybe we can implement this. Okay. Question here. It says, this is not meant to be negativity, just interested. What is the business model? Does the National Aging in Place Committee get paid if people wanted the service providers on the website? What is the percentage of the budget covered by entrance fees? I think probably what this person is talking about is there is a model out there of referral sources that get paid a percentage of, is that the model, or is this a membership model?
This is 100% a membership model. We don't get paid for any, we're an education and mission driven organization, and our mission is education. So we don't get paid for any of the services we provide, any referrals that we do. Honestly, the only income other than membership is this book now. So we make money off the book, which is not a lot. That's not the purpose of the book, but yes, we're all driven by membership fees. And I'm technically the only employee of the group. Everyone else is volunteers.
Great. So that's a pretty lean organization. And then I think just kind of jumping on there, I did see that as a member, you have a code of conduct on here that, hopefully all the organizations and all the employees abide by. So really good question there. I'm glad that you asked that, because there are a lot of sort of referral pay to play based organizations out there, and great question. And that's one of the things that probably everybody in the book would say is that you got to be an advocate for yourself. You've got to ask questions, and getting multiple opinions. It's standard practice in the medical profession to talk to two providers before somebody cuts into your body. And so there's no reason why you can't have that for any of the choices that we are talking about here today. And holy cow, I just looked at the clock. I'm psyched that I think we've got through most of these the questions here, but it looks like we're at the top of the hour. By no surprise, I knew this would be a really dynamic discussion, and hats off to you all for the direction that you're taking this organization and the book. And the person said here, the person that asked that question said, "This is very good to know. That means that other nonprofits can be comfortable linking to you." And that's, especially like the villages. I see there's a lot of chatter with the villages. That's, I know one of the areas of concern of villages is sending their members to an organization and being a nonprofit, which you are, correct?
Yes, we are. And also I'll add that any service provider that you see in our directory, one of the requirements of membership is a background check. And we require that every 3 years. So we really make sure that the people that we are sending into the older adults home have been vetted.
Excellent. All right. So thanks so much. I know a lot of people were wondering how to cut and paste the chat. Don't worry, that'll be with the recording, which I'll have up later today. And we also put these things on a podcast so you can walk your dog and listen to it. But Tara, if you don't mind, if you can send over, details on all the authors, I'll make sure that that's underneath the recording there. And I'm really excited to have reconnected with your association and get to meet all these folks that are on the screen today.
Yeah, well, thanks for having us on. I hope to see some of you next week at Aging in Place Week too.
Yeah, make sure to share that link, and I'll provide a link to that with the recording as well. All right, folks.
Thank you for the opportunity. Thank you.
Yeah, have a great weekend. It's Friday.
Yay!